Okay, guys, short live to talk about the anterior funiculus, and I already talked about the posterior funiculus, the lateral funiculus, and now we're gonna talk about the anterior funiculus. And the anterior funiculus primarily contain descending tracts. If you remember, last time when I talked about the lateral funiculus, you probably still remember that I show you that we have descending tracts. Okay, we have 3 here, and we have ascending tracts. Okay, we have like a mix of descending and ascending, but the anterior funiculus is primarily formed by descending tracts, and I'm gonna talk about each one in details right now. Now, also before I start, this region in specific, okay, the anterior funiculus, it's important in motor control and sensory transmission, and it's just to remind you, because again, it's just to, probably you know this, but it's always good to remind. But comparing with the posterior one, that's mainly sensory, you might already have an idea the reason why one is mainly sensory, the other is mainly motor. Okay. Now let me just use the pen to mark the spinal cord. I forgot to clean this yesterday. Let's see if it works. The last few days is a bit dry here in this area. Yeah, it looks like it wants to work. No, maybe no. Okay. Okay. Posterior horn. Lateral and anterior horn. And then we have the specific tracts that I will be talking right now. The first one is the vestibulospinal tract. This one, vestibulospinal tract. I hope you can see, guys. Vestibulospinal tract. This one. Okay. This one is descending. And originates from the vestibular nuclei in the brainstem, and this tract will descend through the spinal cord, and it will help to regulate the posture. So this is something that might be relevant, especially if you already thought about the relationship between the posture and the nervous system. Posture balance What else? Muscle tone. Everything will be related with this tract. And clinically, when damaged, the patient might present impaired balance, difficulty to stand or walk, and also changes in the muscle tone. Hi, Dani, welcome. Okay, so we have here the vestibulospinal tract, which I'm going to differentiate with the orange color. Okay, what I'm gonna do, I'm gonna also do this, and then, yeah, it's fine, no? I think that's enough to have a better view. The second tract is the anterior spinothalamic tract. The anterior spinothalamic tract is this one right here, okay? This is the anterior spinothalamic tract. Anterior spinothalamic tract. So we have here this anterior spinothalamic tract, and this is the only ascending tract. Let me just put it right here. Ascending tract. Okay. Sorry, within the anterior funiculus. Remember that I'm talking only about the anterior funiculus, okay? This one is representing the lateral funiculus, and this one is the posterior funiculus. So right now I'm talking about the anterior funiculus. So knowing that this is the only ascending tract, now what is the main function? Carry pain and temperature sensation from the body to the thalamus. And the fibers will decussate at the level of the spinal cord before ascending, okay? And usually when damaged, when this tract is damaged, the patient might present altered pain sensation, perception, or even loss of temperature sensation on the contralateral side of the body, okay? Just remember this. Loss of temporal sensation on the contralateral side of the body. Okay, let me just use this one. This color here to differentiate the anterior spinothalamic tract from the vestibulospinal tract. Okay, I already presented two tracts. Now I'm gonna show you another one, which is this one is the medial reticulospinal fibers. What I'm gonna do, I'm gonna just use the blue one in this area. And let me write here. This is the medial reticulospinal fibers. And these fibers will originate from the reticular formation in the brainstem and descending and will descend through the spinal cord. They will decussate with, actually, they intermingle with descending autonomic fibers, which makes these fibers in specific play an important role in modulating muscle tone and postural control. When damaged, the patient might, when these fibers are damaged, the patient might feel that the muscle tone will change, posture will change, and overall motor coordination can change too. So let me just use the blue one here. Then we have the sulcomarginal tract. The sulcomarginal tract is this small one here. And to mark this one, I'm gonna use this color, the red one. Okay. Sulcomarginal tract. This is the sulcomarginal tract. And this is also descending. Remember, this one is medial reticulospinal fibers are descending too. And this one is also descending. So let me just put here. So this tract is not well defined, but is mainly involved in transmitting signals related to fine motor control and coordination. And it will originate from the cerebral cortex and will descend through the spinal cord. When affected, you can presume the areas that will be affected, but I will tell you. So areas that can be affected, okay? Motor precision, ability to motor precision, especially through its specific role, and yeah, mainly this. So motor precision. Thanks, Vanusa. So next one will be the anterior corticospinal tract. And the anterior corticospinal tract will be here. This one right here. Okay, anterior corticospinal tract. Okay, this is the anterior corticospinal tract. This one is also descending. This one is also descending and originates from the primary motor cortex in the brain. And this tract descends through the spinal cord without crossing over, okay? It will mainly control voluntary movements of the limbs, particularly the distal muscles of the hands and the feet. And when damaged, the patient might present weakness or paralysis of the contralateral limbs, especially affecting fine motor skills, okay? Now, the last one, let me just use the pink one for this. And the last one will be the tectospinal tract, this one. Wait a second. This one here. Okay. Tectospinal tract. Tectospinal tract is also descending. Is also descending. Okay, and this tract will originate from the tectum in the brain, and it descends through the spinal cord, playing an important function in coordinating reflexive movements, orienting the head and the eyes towards stimulus. When affected, it can result in impair of a reflexive response and coordination of the head and eye movements. Okay, so this is what can happen when tactospinal tract is affected or damaged. So these are the tracts of the anterior funiculus. So we have posterior funiculus, lateral funiculus, anterior funiculus. After cover the tracts, we can explore a little more the spinal cord. We still have a lot of things to explore here, and bear with me because I will be talking about the other structures and clinical implications as well, related with these structures individually. So this is the video for today, guys. I hope you enjoyed. The full video will be on my YouTube channel. I will probably release like a fragments of this video on my TikTok, but it will not be complete. Okay, so no, it will not be the full video. If you want to watch the full video, consider to subscribe to my YouTube channel and support this work, guys, because what I've been sharing here is not only for anatomy education, but also for medical education. Thank you so much again, and see you next time. Oh,